Hi YouTube, it's Michelle, and I'm coming to give you an update about my recovery from my thyroid surgery. So I just wanted to give you a little more specific information about what happened. I have I had thyroid nodules. So I had three thyroid nodules on my left side, and one was covering my windpipe, so it was pushing down, closing off my airway. So it was getting bigger. I found it last year in January, and I had a biopsy. I had two biopsies, both came back benign. My thyroid was functioning okay. It was just that I had these three nodules in there, and so I decided to do a left side lobectomy, and they also took out the isthmus, which is like the center part that connects the two lobes of the thyroid together. And so the surgery went pretty well, and I wasn't sure what to expect, but now that I know, maybe I can help other people kind of figure out in general what to expect when you're facing thyroid surgery. So the first thing is obviously you've got to go through your insurance, find a doctor, and there's so much paperwork, and you've got to get your pre-op clearance. So those things need to get done before you can even register at the hospital for your surgery. Um, and you should get those things done as soon as possible. Like my surgery happened really quickly from the time I got the results of the second biopsy to when I actually had the surgery. So in mid-December, I got the results of the second biopsy, and then mid-January, I had the actual surgery. So it was about a month. Oh, I'm sorry. I'm Vicodin. But anyway, it was about a month into, between that time, and there was a lot of things to take care of. So, and also like if you change your insurance, then you've got to update all that information at the beginning of the year, and that's what we did. We chose a different insurance plan, and so that was part of what we had to do. So maybe if you're going to schedule a surgery, you might want to do it after your insurance plan goes into effect. I mean, obviously, if it's an emergency and it has to get done, you want to do it as soon as possible. But if you have a chance to get all that information together beforehand, it'll make life a lot easier. So, and then you also want to verify that everybody is in your network so that you don't get slammed with a whole bunch of bills that you weren't anticipating after your surgery. But so just to say what happened with me, I checked into the hospital around 9 a.m. in the morning of the surgery, and we registered and everything, and then I went in for the preparation. So I was given a gown and socks, and it was an outpatient surgery, so I was supposed to go home the same day. Um, so I did the preliminary tests, and yeah, so then the surgeon came by, and I talked to him for a few minutes, and I talked with the anesthesiologist, um, because I had to be intubated during the procedure. And then after a little while, I was wheeled to the operating room, and they put me on the operating table, and they kind of set me up, and just remember this, drip. He was putting stuff in my IV, and then the next thing I knew, I was in the recovery room. It's this very strange sensation to, you're 1 minute you're in one room, the next thing you know, you wake up and you're in a completely different room, and you have no idea what happened. So, I mean, that's a little disconcerting because I have no idea what happened during the operation. But I came out, and I had this little incision. It's a little bit swollen. So I think that's normal. And let's see, I had operation Thursday. So Thursday around 2, I think they finished. Friday, Saturday, it's Sunday. So about 3.5, 4 days post surgery, and not really in a lot of pain. I've been taking Vicodin every 6 hours. It's because um, it's helping me to relax. And I can tell when I stop taking it because I get really intense pain in my chest and then in my throat. Swallowing, It hurts a little bit, but it's not too bad. But one thing I will say with the intubation, because they do it on the right side, and I've got a lot of soreness on this side of my mouth, and I had some blistering, and the back of my throat is swollen. So, and that's very uncomfortable. And it doesn't feel as bad, but yeah, that's something I wasn't expecting. So when you're intubated, just know that it's possible to come out of it because they don't explain it to you. And I just had to kind of look it up and go by my own experience. And it's possible for you to suffer some damage to the sides of your mouth or inside your mouth. But like I said, it's getting better. It's just like a little irritated. And my voice is better today, but there's some ranges I can't reach, and I feel like my son doesn't really know like this voice, and so he's kind of scared of me right now, which is a little sad, not kind of upsetting, because I call his name, but I'm not saying it in the same way that he's used to. So I guess it sounds like a stranger's calling him. Um, but we're working through that, and yeah. So I go for my pre-op or my post-op follow-up on Friday. So at that point, I'll be checked out. They'll check my incision and everything. And then, I mean, I'm really good. I can turn my head side to side. It hurts a little bit, but not too much. It's not really pulling at the incision. I can bend down and I can bend back. And that pulls a little bit. But yeah, I think the recovery is going pretty well. And I can definitely tell it's just like strange to know that, something that was in there your whole life is now gone. But I can really tell the difference. I don't have that pressure on my windpipe. And so it's a blessing. Anyway, so I had the minimally invasive endoscopic left lobe thyroidectomy and isthmusectomy. So, yeah, the video assisted method, the endoscopic method, results in a smaller wound. And when I get the tape off, I'll show it to you. I don't think it's going to be that bad. So I'll probably do an update on Friday when I get back from the doctor. Let you know like what he says, how things are going. And yeah, other than that, that's all I basically wanted to say. Just if anybody's facing this thyroid surgery, just know that from what I understand and what I've experienced, it's a pretty safe surgery. The recovery time isn't that bad. I mean, I'm walking around. One thing you want to be careful of is not talking too much, which I'm probably doing right now, because that's when it really starts to hurt. So you've got to pace yourself and just make sure you get your rest, because that's what's been most helpful to me. That being said, I'm going to go back and rest. So hope everyone has a good evening, and I hope this is helpful for somebody. Okay, thank you. Good night.